Disturbing story here. Top U.S. health officials are saying that the more they learn about the Zika virus, the scarier this thing is becoming. Right now, there are nearly 350 cases reported across the United States. U.S. health officials are now asking for nearly $2 billion to help deal with this issue. Jonathan Serrie is live from our Atlanta bureau. So, Jonathan, what's the latest with all this?
Hi, Martha. Well, federal health officials admit they don't know everything about this virus, but the more they learn about Zika, the more concerned they become. Although most infected adults show mild to no symptoms, there are reports of rare neurological problems in adults, including Guillain-Barré syndrome, a form of paralysis. But the biggest concern remains the unborn babies of infected mothers. Federal health officials now believe the virus poses a threat for much of pregnancy, not just the first trimester, and that it causes birth defects beyond babies born with microcephaly or unusually small heads. Listen.
Most of what we're learning is not reassuring. We have learned that the virus is linked to a broader set of complications in pregnancy, not just the microcephaly, but also prematurity, blind eye problems, and some other conditions.
Another concern, the mosquito that most easily carries Zika is more widespread in the U.S. than originally thought. Take a look at this map. It's found in at least portions of 30 states. So as the weather heats up, we could begin to see the first cases of mosquito-borne transmission of Zika here in the U.S. mainland. President Obama asked Congress for $1.9 billion to support research into mosquito control, vaccines, and other efforts to fight Zika. But congressional Republicans pushed back, insisting the White House should first use funds earmarked for Ebola research. The White House is following that guidance for now.
We couldn't just stop and wait for the money. We had to go ahead for it. The only trouble is if we don't get the money that the president has asked for, we're not going to be able to take it to the point where we've actually accomplished what we need to do.
And federal health officials point out that the Ebola threat hasn't completely gone away, and they say funding is needed for research to combat multiple disease threats at the same time. Martha?
What's the plan in the United States for right now?
Yeah, well, right now in the United States, the only cases of Zika on the mainland, Zika is spreading in Puerto Rico and other U.S. territories, but in the mainland, the only cases involve returning travelers who became infected abroad, and in a few cases, Zika that was passed on by sexual transmission. There is not yet mosquito-borne transmission, but federal health officials say that it is quite possible that we're going to see at least small pockets of mosquito-borne transmission. So they say it's very important that local communities adopt mosquito control policies, and that these communities coordinate with one another so that they can show a united front to this very real disease threat.
No. Jonathan, thank you very much.
It'll be a big deal.